YouTube channel. I'm super excited to be back. It was almost a while to film this video, but I am here. I said, I have devoted myself to this YouTube and I'm going to be consistent. It's not easy. Hey. First of all, I want to say a very, very big thank you to you, my wonderful family, for the amazing love you showed my last video. Like, I would not have thought in my wildest dream that that video was gonna go viral the way it went. Like, the last time I checked, it was over 900 views and we have not even reached 1 week yet. Thank you so much. Thank you for sharing. Thank you for reposting. Thank you for commenting. Thank you so much. God bless you and God increase you in Jesus' name. Wow, to my subscribers, oh, you guys know you occupy a very special place in my heart. Thank you for subscribing, thank you for liking, thank you for always showing up for me. And to people that see my face for the first time, wow, you are highly welcome. I want to let you know that you're in the right place where you get amazing content back to back. This is not a place where you just be seeing content that will just be going all over the place. No, content that makes sense, content that speaks to your needs. Yes. Content that gives you information, education, motivation, whatever it is that you need. Yes, on this channel. I want to say, you know, my love language is when you subscribe. So you have to just help me to do something very special. Just click that subscribe button. Just turn on your notification. But just like the video. The goal for today is that I want to have 100 likes on this video. Yes, 100 likes. So I know we can do it. So let's just keep giving the video a thumbs up, a thumbs up, a thumbs up until we get to 100. And yes, we can even surpass 100. Why not? Yes, so today we're going to be talking about something very interesting. So let's jump right into the video. So today we're going to be talking about something very interesting. This will be a short video and I'm just going to give you highlights of everything I'm going to say, but I want you to know that it's going to be informative and going to be educative. Today we're going to be talking about this topic I have called basic tests you should do once you clock 35 years. Yes, basic tests you should do when you clock 35 years. Now, one of the things I noticed, or when I've been practicing medicine for about almost 2 years, but I've been in the clinical setting, the hospital setting for close to 6 to 7 years, because I crossed to clinical medicine in 2017, so that's like literally 7 years right now. And I've seen a lot of things, and one of the things that usually cause what we call a poor outcome in patients that come to the hospital is when they present or when they come to the hospital late. And why do they come to the hospital late? Because they've been going everywhere but the doctors. They've gone to their spiritual leaders. They've gone to one mama that is mixing one oil. They've gone to somebody on the mountain. They've gone to the roadside chemist. They've gone everywhere but the doctor. So when they've gone everywhere, they've done everything. They've climbed the mountain. Now this is not discountenancing the power of prayer, but I'm just saying that when there are things that need to be sorted out scientifically, you do that, right? And when they come to the hospital, it is late, and then they expect the doctor to do magic. Like I said in one of my videos, we're not magicians, we don't do magic, right? So there are some basic tests that you should do when you clock 35. Why? This will help you to be able to prevent or at least screen yourself for some basic or common diseases in our environment. And what are the common diseases in our environment? Hypertension, diabetes, cancer. Cancer is very common. Don't even think it's something that just happens. It's very common. Cancer, heart disease, heart attack, what we call myocardial infarction. So many things like that. And we need to be able to identify these things on time so that we can start treating them early. Now, there is an aspect of medicine that we call preventive medicine. And what is preventive medicine? It's that aspect of medicine that helps us to study how we can prevent diseases so that they do not occur in the first place. The best way to cure a disease is to either catch it early or even prevent it from happening in the first place. And that's why I'm going to be giving us a breakdown of this test. Now, this is a disclaimer. These tests are just recommended for people that are over 35. It's not like it's a must. Oh, you now go to your doctor tomorrow and say, oh, I watched Dr. Debs on YouTube and she said we should go and do this test. Let your doctor still examine you for what we call risk factors. And I'm going to be saying that a lot. So let me just put it out there. Risk factor. What does risk factor mean? It's basically something in your body, in your genes, in your lifestyle that puts you at risk of having a particular disease, right? So let your doctor take a good history from you. Let them ask you some vital questions. Let them examine you, and then if you think you still want to go ahead with the test, right, go ahead. But these are just recommended. I'm not saying it's a must. So that's the disclaimer I'm putting out there. So these things are important. So I want you to start to take note of these tests as I talk about them. Now I'm going to divide them into 4 major parts. I'm going to divide them into blood tests. I'm going to divide them into routine checks. Number 3, I'm going to divide them into other miscellaneous, and then I'm going to divide them into gender specific tests. So let's jump right in. Now for the blood test, the first blood test that is important that you do once you're over 35. In fact, it doesn't even only have to be when you're over 35. This one you can do it once you are an adult. It's the full blood count. Full blood count. Now, what is full blood count? Like the name implies, we want to count the number of cells in your blood. Now, in your blood, we have different cells. I'm not going to go too deep. We have the white blood cells, we have the red blood cells, we have what we call the platelets. Those are the major cells in our blood. The red blood cells are the ones that carry oxygen. They have a pigment in them called hemoglobin that carries oxygen around the body so that you can breathe well, right? Also, we also have the white blood cells. They are like the soldiers in our blood that helps to fight what? Infection. And we have the platelets that help to clot blood. So when that time we are chopping plantain and then the knife mistakenly cuts your hand, that thing that makes the blood clot and the bleeding stop is what we call platelets. So basically what the full blood count is like it takes an entire a photograph of all the cells in your blood and then quantifies them, right? So your red blood cells should be between one range and another range. Now this is specific for, there are different ranges. Now we don't have specific numbers in medicine, we have ranges because everybody's body is not the same, right? So we have ranges, and we have also different ranges for male and female. So I'll try to put something here so that you can see the different ranges. Now the second blood test that you should do when you are over 35 years is what we call a lipid profile. Now what is a lipid profile? Lipid means fat in basic terms, and what lipid profile does, it looks at the level of your total cholesterol. It looks at other lipids in your body. There are some lipids that should be high and some lipids that should be low. Like we have a particular lipid called high density lipoproteins. Those ones should be higher than the low density lipoproteins. We don't want them to be high at all. So these things are important because it is having them in high values can predispose you to what we call, I'm not going to call this thing in a way that it's not sound big, atherosclerosis. Now let me just break it down. Athero means artery, right? Sclerosis is when there is a narrowing of the artery wall. Why? Because there's an accumulation of what we call plaque, and the plaque comes from when the fat is too much. So now someone is like, okay, so you're saying once I'm fat, I would have a narrowed arteries. That's not exactly what I'm saying. There's a possibility. That's why obesity is a risk factor for that atherosclerosis. Right, is a risk factor. So that's why you want to also work on your weight, and I'm going to be talking about that very soon, so I don't want to jump ahead of myself. But basically that lipid profile is something you want to check. You want to be sure, because when there are plaques accumulating in your arteries, one day it's going to occlude or block one of the major arteries that supply blood to your heart, and that's what causes a heart attack. Right, now let's jump into the second group, which I call the routine checks. Routine checks. Number one routine check you must do is your blood pressure. This one, don't even wait till you're past 5. I would recommend, if you can afford it, please buy a digital sphygmomanometer. Buy it and keep it at home. You wake up in the morning, just check your blood pressure. Everybody knows the economy of Nigeria is very stressful right now. You don't know, before you be carrying 250 over 180 blood pressure up and down, please be checking your blood pressure. I'm still going to do a video on the correct way to check your blood pressure by yourself. Check your blood, especially if you have a risk factor like parents that have high blood pressure or family members that have high blood pressure. You cannot afford not to be checking. Please check. And when you check, don't just check and move. Be documenting what you are checking. Get an exercise book and be documenting these things so that you have a range, so that when you come again and check next week, you'll be able to compare, so that you will see, okay, this thing is increasing. Was my stress level increased this week compared to last week when it was like? So make sure you document it it so that you can compare the value. The second routine checkup you must do is your sugar. And you're not going to do it after eating. You're going to do it first in the morning when you have let your when you fasted for about 8 to 12 hours, or when your last meal was about 8 to 12 hours ago. This is the best time for you to go ahead and check your sugar. Now, the third most important routine check that you must do is what we call your BMI. What's BMI? BMI is body mass index, and basically it's a formula. You're going to take your weight in kilogram divided by your height in meters, then you square the value of your height in meters, and then take your weight and divide it. So if my weight, for example, is 60 kg and my height is 1.5, so I'm going to do 60 over 1.5 into brackets squared. Then whatever I get would be my BMI. Now there's a table which I'm going to show here now for you to know whether you are underweight, your normal weight, you are overweight, or you are obese. Now this is important so that you can know what your risk factor is. If you're overweight, that means you have to work on your weight. That means you have to start to reduce your intakes of certain foods. And I'm still going to do another video on how to lose weight in an healthy way. But aside from that, you have to know your BMI so that you can actually, because some people might actually feel like they are not fat as well, but your BMI is overweight. And some people might feel like, oh, I'm slim, but you are in your weight, your BMI is within the normal weight range. So it's not about how you look, it's about what the BMI says. And that's what actually tells you if you are healthy or if your weight is healthy or not. So the next test we're going to be talking about are the gender-specific tests, the ones for male and female. Now I'm going to start with females, and these tests are basically for cancers, because cancers are one of the most common causes of death in this part of the world. So we want to make sure we can detect it on time so that we can treat it early if we find anything that is suspicious. So the first thing is what I call a clinical breast examination. It's different from a self-breast examination, which you should do every month after your period, 7 days after your period. But this is different because it's your doctor that does it for you. It's still the same process, but now it's more detailed because your doctor will be the one doing it for you, right? So it's very important to get it done at least every year. If you have a risk factor for breast cancer, someone in your family has had breast cancer, then please, you have to do it more frequently, probably every 6 months rather than a year, right? Now the second thing is what we call a mammogram. Now what's a mammogram? It's basically an x-ray of the breast tissue. It's just to see if there are any abnormal growth in the breast tissue. Now this one, like the clinical breast examination is more superficial. They're just checking, feeling, palpating, moving, and just being sure that there's nothing that we can feel. Now the mammogram takes it a step higher and actually sees the internal structure of the breast to see if there are any internal growth that we cannot feel with that the doctor will not be able to feel, or even you when you're examining your breast will not be able to feel with your bare hands, right? Now it's important to detect breast cancer. I don't even need to overvlog. I'm sure there's been a lot of awareness about breast cancer in the past few years, so I don't need to overflow that. Now the third thing is what we call a pap smear. Now a pap smear is specifically for cervical cancer. What's cervical cancer? Basically the cancer of the mouth of the womb. The mouth of the womb is the cervix. That's how we describe it for people to understand. So it's basically a cancer of the mouth of the womb. So we want to check the cells at that mouth of the womb to check if there's anything that is abnormal, anything that is suspicious, anything that may want to raise our eyebrows. Oh, this thing may have some cancerous potential to become a cancer later on in the future if it's not dealt with now. So it's very simple. It's a screening test, and it's advised that you do it every 3 years, especially when you are sexually active. Actually, this should even start from when you are sexually active, and it's just the virus that causes this cervical cancer, which is what we call the human papilloma virus. It is very, very, very fast. It's a very ravaging virus, and it's important to get it detected early if there's anything, because I've seen people 26, 24, 25. I can even see the picture of the patient that was 26 in my head that died of cervical cancer when I was doing housemanship. So it's literally, you don't have to do it when you're there. Once you're sexually active and you're above 18, you can get this thing done. I'm still talking about vaccines to take in another video. Now the next one is for the males, the gender specific test. The males, there's just one test, and it's a prostate specific antigen, what is abbreviated into the term PSA. Is important, and I would advise that you could start checking from like 40 and above, because prostate cancer is also a very, very silent cancer. It's one of the most silent cancer. It doesn't really say much until when I say much, it doesn't really bring many symptoms until when it is already advanced. So you want to catch it early, especially in the younger age group. So that's why it's important to get it tested. So once it's above, the value is above 4 nanogram per mil, it's suspicious. And that's why I will reiterate, always review your results with a doctor. Don't just take the results and just let your lab scientist just face one thing or the other. No, always get a doctor to review the result. The lab scientist has his own training to do the investigations properly. The doctor is there to review and interpret the investigations. Okay. So yes, I think that brings us to the end of this video. I believe that you have learned one or two things in this video, and you would also want to share this information with people around you. Please do not hesitate to share it with people around you. Get it to go viral. Let people hear that these are the things that you should do once you got certified, so that you can prevent some diseases, that is the major or the common disease in the environment, from being something that you have to start dealing with. Yes, thank you so much for watching. Do something for me, please. Hit that subscribe button. God bless you, and don't forget to like this video. The goal for today is 100 likes, so please like this video and don't forget to subscribe, turn on your notification bell, and I'll see you in my next video.